Today we're going to be talking about proper hand washing. Upon completion of this session, you will be able to list the 5 steps of hand washing and provide 3 examples of when you should wash your hands. So we're going to start with the steps of hand washing. First, we're going to wet our hands with some water. This water must be clean and running water, and then you're going to apply your soap. This can be liquid soap or bar soap, either one. You just have to get some soap. Next, we are going to lather our hands. When you're lathering your hands, you're going to take the soap that you've put on your hands and you're going to make it foam up and get all sudsy. When you rub your hands together with the soap, you need to get the backs of your hands. You need to get between your fingers and underneath your nails, because that's where a lot of germs like to sit and fester underneath your nails and in between your fingers. The next step is to scrub your nails. You're going to scrub for at least 20 seconds. Now, a good way to remember to scrub for 20 seconds is to actually hum the happy birthday song from beginning to end twice. So when you're going to be scrubbing, you're going to not just kind of slowly, you're going to be hard scrubbing this soap in between your hands for at least 20 seconds. And remember to also get the backs of your hands in between your fingers and underneath your nails. The next step we're going to do is we're going to rinse, and that's with, again, clean running water. You're going to rinse from the tops of your hands to your fingertips, and you're going to let that soap come off of your hands that way. Now, the last step we are going to be doing is we're going to dry your hands, and that is going to be with a cloth, paper towels, or you can let your hands air dry, but it's a lot faster, especially in the nursing profession, to actually dry your hands. And you need to take the paper towel or the cloth before you actually turn off the faucet. And this is because you don't want to wash your hands and then touch the faucet. That kind of eliminates the whole fact that you washed your hands. So you're going to take the towel before you turn off the faucet, and you're going to use that to actually turn off the faucet. And those are the 5 steps. Again, you're going to wash, you're going to lather, you're going to scrub, you're going to rinse, and you're going to dry. Those are the 5 steps to washing your hands properly. When should you wash your hands in the first place? Well, there are many times you should wash your hands. You should definitely wash your hands after going to the bathroom. That's 1. You should definitely wash your hands when you're preparing food, whether it be before, after, during. Sometimes you're going to need to wash your hands, especially in nursing. You're going to wash your hands before and after you're caring for someone who's sick. So if you have multiple patients in multiple different rooms, you need to wash your hands before going into the room, as well as washing your hands after you go into the room. A couple of other examples: if you're going to be touching animals, you need to wash your hands. If you blow your nose or you cough or you sneeze on your hands, you're going to definitely need to wash your hands. After you touch garbage, if you take it out, then you're going to need to wash your hands. Keeping your hands clean is one of the best steps you can take to prevent infection control and disease spread. This is because everything that you're touching can harvest germs and disease, and that's when you touch something and then you touch someone else. That is one of the best ways for diseases to spread. So this is a great way to prevent diseases from spreading and infection control. So now at the end of my session, you should be able to list the 5 steps of hand washing, and again, that is wet, lather, scrub, rinse, and dry. And then, as I just talked about, we are going to wash our hands frequently. Thank you for listening.